All right, everyone. Today is week 5. Not week 5. Today is week 3. Sorry, I'm staring at the number 5. And we are going to be diving into, again, all things MFL. So let me share my screen and let's get started. Okay, today we're going to be going over orbicularis oculi and going over how you sign charts, and then also going over AR, how to take care, credit, and cherry, and then our marketing homework for the week. Okay, so let's talk about orbicularis oculi. This is the circular sphincteric muscle that it goes around the eye, also known as the crow's feet area. It is traditionally a depressor muscle group. It is responsible for closing your eyes and blinking. So it is a normally depressor muscle group. Remember, when we put neurotoxin into a muscle, it forces it to do the exact opposite. So now it's going to become a strong elevator. And again, this muscle goes all the way into the eyebrow as well. That's why when we do a little eyebrow lift, the muscle that we are actually treating is the orbicularis oculi muscle. So just a quick review, we call the orbicularis oculi a medium muscle group. So it can handle 5 fluid units into each injection point. And for Botox, that would be 2 in each injection. So it is traditionally a 3-point injection point. And remember, 5 fluid units, regardless of the product that you're using. And this only works if you reconstitute Botox with 2.5 and Dysport with 3. So very simple. You want to make sure it's pointing towards the ear. And I always kind of say one out, one up, one down. And whenever you're injecting, you want to inject away from the eye at a 45-degree angle. Any questions on the review of crow's feet? Perfect. Okay, we're going to go over how to sign charts. So not only can you sign charts directly in the app, there's actually a button that says send to MD. You can also do it from the .com, and it's very simple to do. So what you're going to do is you can log on to Aesthetic Record via the .com and hit login. And then once you log in, you can go to Provider Room in the upper right-hand corner. And you click on cosmetic procedures, and these are all of the charts that I have currently open. And you cannot forward a chart unless you have all green check marks, with the exception of the prescription. You are not going to have a green check mark for the prescription. So once you have all of these green check marks, that's when you are able to fully sign the chart. Very simple to do. You're going to click on it. And if you wanted to batch all of them at one time, you absolutely could, but obviously I can't because I still have some charting that I need to be updating. And go to action, and then you're going to do sign and send to MD, and then hit complete. Very simple. So any questions on how you sign charts? This should be done by the end of every single month. So please make sure that is complete. If you don't, you might be getting an email from Bernard. Bernard does a chart audit for 100% of all of our charts to make sure that everything is done correctly. Again, this is just to make sure that we protect your license and our supervising physician's license as well. All right. So we are cashless now with MFL, and we did this because we took a poll with the injectors and they actually requested this. They did not like having to go to the bank. So now we can use Venmo or Zelle. If they want to Venmo, it's going to be at MyFaceLady. If they want to Zelle, the email is pay@myfacelady.com. And for Care Credit and Cherry, so Care Credit is a 2-step process. It is very simple. You can actually check the patient out in Aesthetic Record, but then the second part is a second step that you must do through the carecredit.com. And what you do for this, you're going to go to the www.carecredit.com and this exact web link. And then from there, click Pay Now, and then it will walk you through the data, and then you actually find everything that you need in that web page for you to go ahead, and then the patient can click on that their side of what they want their payment to look like. So that is for Care Credit. And then for Cherry, it is fully integrated within Aesthetic Record. So you just simply click the Cherry button and it walks you through that process directly within the Aesthetic Record app. It is very simple. And for patients that want to see if they get qualified, they don't pre-qualify, at least as of right now, but we typically don't see people that don't qualify for Cherry. They just have to have that amount available on all their credit cards, totally available. All right. For the homework this week, you are now going to reach out to 2 salon accounts. And this is really just to start putting feelers out there, saying that what you can do in the future after you have your launch party. And then once you have your launch party, you can then start seeing people at those salons. And these can be things like dentist office, esthetician offices, primary care doctor, hair salons, massage, you name it. If it is any type of salon or office, then we can partner with them. And how this works is the salon will actually get paid per every 15 minutes. And so we break it down in 15 minutes and 45 minutes. 15 minutes is a neurotoxin and it's a flat rate fee. And 45 minutes is a filler appointment and that is a flat rate fee as well. So we essentially rent out their space in 15 and 45-minute increments. And that way the salon owner can also get paid for that as well. So it's a win-win for everybody. And then for the posting for this week, you're going to post a before and after of crow's feet. And we're going to ignore the Juvo right now. So it is going to be a before and after with crow's feet. So I do have that just because we just recently dropped Juvo. And so I have that graphic for you. So you can simply just grab it and post it. And then you're also going to do one education post on what resting stasis is. So think back to training. What is resting stasis? Those are those lines that are etched into the skin due to constant movement and they can be seen at rest. And those are what we are actually trying to get rid of with neurotoxin because that's what truly ages the face. Or those resting static lines that almost appear to look like scars. They do take time to go away, so it's not something that's going to go away with one neurotoxin treatment. It is something that the patient is going to have to keep up with. That way, those resting lines can completely fade away. And then this is the week that we want to start your social media following of learning additional people to follow. The first one is going to be Professor Sebastian Codafana. He is an anatomy guru and he does a lot of cadaver labs. And so he does a lot of education on his page and he's really fascinating to listen to. And then Tim Pierce is going to be the other account that I want you to follow. Again, he does a lot of education. Like I told everyone in training, there are 1,000 different ways to skin a cat, and I want each and every one of you to be a sponge and try to learn anything and everything that you can. So I'm going to slowly start introducing additional accounts for you to follow. Of course, this doesn't mean that you can't follow more. I'm just trying to kind of give you some of my favorites. So that is it for this week. Nice and short and sweet for this quick Mother's Day weekend. Does anyone have any questions for me?
Hi, Anne. I actually have a couple questions.
Absolutely.
So as far as I'm gonna be having my launch party soon within the next 2 weeks, and so I'm already have a couple of people who are already on my schedule, but I have most of my people that they've never had Botox done before, and so I know that there's the Botox and the Dysport. So how would you go about like introducing them to which one you advise them to get first, or I don't know how to go about that.
Yeah, if they've never had anything before, I love Dysport personally. I think Botox is just the brand name, but I
Okay.
love Dysport. And then once you treat your 8 patients, we're going to be opening up Daxxify to more and more injectors, and so you'll have an additional neurotoxin to kind of add to your arsenal. But I would start with really kind of just Dysport. It's a little bit more cost effective than Botox as well, and so that will kind of help out. And they have a great rewards program compared to Botox. If you can't tell which one I like better.
Okay. Yeah, yeah, okay. Because just in case they ask me like, oh, like why would you pick this over this? Is there something that you usually tell your patients, or is that just a
Yep.
personal preference?
Nope. Yep. So Dysport tends to be a little bit more natural looking, where Botox tends to freeze.
Okay, okay. And then for the Venmo, I kind of missed if they want to send through Venmo, what was the email or the phone number?
For Venmo, it's just at my face lady.
At my face lady. Is it the at sign or at AT?
It's the at sign.
Okay. Thank you.
You're very welcome. Does anyone have any other questions?
I had a question, Anne,
Yes,
about the salon. The salon reach out. So, like I have a friend that has her own salon space. Would that work the same?
yes, ma'am.
Okay. And so then what information do I give her? Just say, hey, I want to, partner with you and do this. And then what do I give her or tell her?
Yep, you'll put her in contact with Ashley, and then Ashley can get her all the information. It's a contract that they sign with us saying that, they will carry general liability insurance, and we have our own general liability insurance, things like that.
Okay. Perfect.
Yeah,
Thank you.
you're very welcome.
I actually did think about one more question, Anne. For the salon, I know if we use them, I think they get a discount, or how does that work?
Yep. So if they have 5 paying patients, then they get 25% off of
And
all their.
it's just the owner or the salon staff, or is it
It's just the owner.
just the owner? Okay.
Yep.
Oh, and then I have one more question. I do have a patient who wants to get her TMJs injected. Is that just Botox? Do you recommend just Botox for that one? Or Dysport works well too?
Are you saying that she has TMJ?
Yeah, she has TMJ and she wants to get her masseters injected.
Her masseters. Oh, so you can use any of them, either Botox or Dysport. The starting dose for Botox is 20, and for Dysport it's 50. I traditionally do the one injection point just because that way you don't run the risk of having migration to the surrounding muscles. And remember, you need to use at least a 1/2 inch needle. Half of the medication is put deep, and then half is superficial, meaning half of the needle depth. That way you hit both compartments of that masseter muscle. Remember, it's almost treated like two muscles, that deep compartment, and then you have that ligament and then the superficial compartment. So you must treat both.
And so you said one injection is just one, because I know in the videos that I watched in the training, it was 4 injection points. So you're saying just do one
Yeah,
and
I
then
just do
do,
one.
okay.
Yeah,
Is
I
there
just
like a specific point that you like
in
to
the
look for?
dead center of it. So have them bite down, and
Mm-hmm.
then you're going to draw on either side. So draw here, and then directly in the center of it, you do one injection point.
Oh, okay. And
That's
then you do the Dysport, you said 50, and the Botox, you do 20?
Yep,
And you do half of it all the way in, and then half of it with the needle halfway out.
correct.
Got it.
Yep.
Thank you.
Yeah, I see a lot of people have mistakes when they do additional injection points when they do the 3 or 4, because that's when you start hitting Resorius or the zygomatic major muscle.
Yeah, that makes sense. Okay.
All righty. Any other questions? Perfect. All right, ladies. Well, I hope you have a wonderful rest of your evening, and I will see everyone next week, and I will post this call and the graphics by tomorrow. Have a good evening. Bye.
Thank you. You too.
Thank you.